A quiet Saturday morning surf on one of Sydney's most popular stretches of coastline ended in tragedy. A 57-year-old seasoned surfer, Mercury Psilakis, was fatally mauled by a large shark off Long Reef Beach on the city's northern beaches. The attack happened at about 10 a.m. on September 6, 2025. Psilakis, a husband and father, had been in the water for roughly half an hour, riding an unpatrolled break between Long Reef and neighboring DY with 5 or 6 friends. Surfers nearby heard frantic shouts of "Don't bite me," and then saw a sizable dorsal fin slice through the water. Moments later, both man and board disappeared beneath the surface. His companions raced to shore, and a short time later, Psilakis's body surfaced in the surf zone. Fellow surfers pulled him onto the sand, but the injuries were catastrophic. Multiple limbs lost and severe blood loss. Despite immediate first aid efforts and the rapid arrival of paramedics, he died on the beach, one day before Australia's Father's Day. Authorities responded quickly. Beaches from Manly to Narrabeen were closed for at least 24 hours, and drones, as well as lifesavers on jet skis, began sweeping the coastline for any sign of the shark. The victim's broken surfboard, recovered in 2 pieces, will be examined by marine experts from New South Wales Department of Primary Industries to help identify the species involved. Fatal shark encounters in Sydney are exceptionally rare. Prior to this, the city had not recorded a deadly attack since February 2022, and before that, Sydney had gone nearly 60 years without one. Australia's infamous shark era of the 1920s and 30s saw a cluster of deaths, but modern-day fatalities in metropolitan waters are uncommon. Nationwide, 2025 has already been a difficult year. A surfer was killed in Western Australia in March, and another is presumed dead after an incident in South Australia in January. Great whites, bull sharks, and tiger sharks are the species most often implicated in serious Australian attacks. Shock and grief have rippled through the tight-knit northern beaches community. Locals describe a mix of sorrow and unease, knowing that the ocean they cherish can still prove unpredictable. Surf Life-Saving NSW and the Northern Beaches Council have extended their deepest condolences to Psilakis's family and urged beachgoers to follow safety advisories as patrols continue. For many, the tragedy is a stark reminder that even on urban, world-famous beaches, the boundary between city life and Australia's wild marine environment is only a few steps and a few strokes away.
In Durham, North Carolina, the City Council has unanimously declared all municipal offices a Fourth Amendment workplace. The September 2, 2025 resolution is a direct response to rising anxiety among the city's immigrant residents over federal immigration enforcement, according to reporting by the Associated Press. So, what exactly is a Fourth Amendment workplace? The name comes from the Fourth Amendment of the U.S. Constitution, which protects people from unreasonable searches and seizures. By invoking it, Durham is instructing city employees to insist on a valid warrant, supported by probable cause, before assisting federal agents in making arrests or seizing property. In practice, the policy limits how much city staff and resources will cooperate with U.S. Immigration and Customs Enforcement, or ICE. Support for the measure grew after an incident last July when 4 plainclothes ICE agents showed up at the Durham County Courthouse. No one was detained, but their presence alone triggered protests and renewed fears of sudden, family-splitting arrests. Community groups like Siembra NC and Durham Can urged local leaders to act before another encounter occurred. During the council's public hearing, immigrant residents and advocates described living with constant uncertainty. Parents who avoid driving to work, children who dread a knock on the door, families who keep go bags near the front closet. Speakers told council members the resolution would not erase federal power, but could prevent the city from actively helping what they see as over-aggressive enforcement. It is important to note what the resolution does not do. Durham cannot bar ICE from operating within city limits, nor can it override federal immigration law. Instead, the declaration is a policy statement. City employees will not share sensitive information, grant access to non-public areas, or otherwise aid an immigration action unless agents present a judge-approved warrant. Staff will receive training on Fourth Amendment protections so they know when they can and cannot legally cooperate. Symbolism matters here. By formally aligning city policy with constitutional safeguards, Durham hopes to calm residents who have grown wary of local government offices, schools, or courthouses. Officials also argue that community trust makes everyone safer. When immigrants aren't afraid to report crimes or serve as witnesses, policing works better for all. Durham is not alone. The nearby town of Carrboro adopted a similar resolution in May, hinting at a regional trend. Both measures have revived debate over so-called sanctuary cities. The federal government once labeled Durham a sanctuary jurisdiction, a term local leaders reject as legally meaningless. Still, the new resolution underscores an ongoing tug-of-war. How far can or should local governments go to shield residents from federal immigration sweeps? For many, the unanimous vote offers reassurance that the city is on their side. For others, it raises questions about conflict with federal authorities. Whatever one's position, Durham's Fourth Amendment workplace signals a deliberate choice. Within the limits of municipal power, the city will prioritize constitutional due process and the well-being of its immigrant community. In short, Durham's action doesn't stop ICE at the city line, but it does set clear boundaries. No warrant, no help. For thousands of families who call Durham home, that line in the sand can mean a little less fear and a little more faith in the place they live.
Amid a new surge in COVID-19 cases, an updated vaccine has arrived, but for many of the people who need it most, getting the shot has become a maze of red tape and surprise bills. The Food and Drug Administration has authorized the vaccine for two groups: anyone 65 and older, and people of any age with certain medical conditions. That narrower guidance departs from previous years, when virtually every adult was encouraged to roll up a sleeve. On the ground, the shift is sowing confusion. California resident Allison Engel, 74, was told at her CVS that Medicare hadn't loaded the new shot. Rather than wait, she paid $225 out of pocket. In Texas, 78-year-old Brant Mittler and his wife encountered the same roadblock. And in New York City, 67-year-old Matthew D'Amico and his 75-year-old wife were refused at Walgreens because they lacked a prescription, something they'd never needed before. Three things are gumming up the works. First, a lag in Medicare's billing system. Some pharmacy computers still reject the claim, even though Medicare is supposed to cover the shot. CVS says many insurers are still updating. Medicare officials say they're investigating, but in the meantime, elderly patients are being asked to pay or walk away. Second, a timing gap at the CDC. Most states let pharmacists vaccinate without a doctor's prescription only after the CDC's Advisory Committee on Immunization Practices, known as ACIP, signs off. That committee won't meet on the new shot until September 18th to 19th. Until then, pharmacies are improvising. Which leads to the third problem, a patchwork of pharmacy rules. CVS now requires prescriptions in 13 states and Washington, D.C. In Massachusetts, Nevada, and New Mexico, the chain briefly paused COVID vaccinations altogether, though Nevada has since restarted. Walgreens has its own state-by-state mix of prescription requirements while it waits for ACIP. The policy is rolling out under the new Health and Human Services Secretary, Robert F. Kennedy, Jr., who has assured the public that most Americans will be able to get it from their pharmacy for free. Senators from both parties say that promise rings hollow while seniors are being turned away at the counter. Although older adults dominate the headlines, the high-risk category for people under 65 is surprisingly broad. Being overweight, smoking, having a mood disorder, or even being physically inactive can qualify you. A 5'4" woman who weighs 145 pounds meets the overweight threshold and is technically eligible. Yet many potential recipients have no idea. Public health experts worry the snarls will discourage vaccination just as the so-called stratus variant gains ground. Every unnecessary hurdle increases the odds of severe illness and fuels skepticism about who can and should get the shot. So what can you do right now? If you're on Medicare and get turned away, ask the pharmacist to rerun the claim or try a different location. Some systems update faster than others. If you're under 65, review the CDC's list of qualifying conditions. You may already be eligible. Call ahead. Policies vary not just by state, but by store. All eyes now shift to the ACIP meeting on September 18th to 19th. Its recommendation will likely decide whether this season's vaccine rollout goes smoothly or remains mired in chaos. For the moment, access depends on where you live, what insurance card you carry, and which pharmacy happens to be on duty when you walk in. The vaccine may be approved, but for many Americans, it's still out of reach.